Hi again. What's up? Mag-hi again na unta ako. Sige, again. Hi again, ako dahil si Ryan.
Ako si Linda.
And today, mag-talk ta about something very related to nursing. What we like and what we dislike about being a nurse.
Yeah.
Kay dugay naman mi mga nurses. Pila na ka years nag-nurse?
More than 10.
Ako po. Same here. I've been a nurse for more than 10 years.
Yes.
So
It maybe this video could help you if you're thinking about should you study nursing, should you not, or maybe you can relate if you're a nurse.
you can comment down below sa inyong mga likes and dislike sa ani nga profession. So let's start. Should I start?
You can start.
So what I like about being a nurse is that there's always jobs. Yeah, there's always jobs. So the first thing the first reason good why I chose this nursing field is that jobs. There's jobs.
Yeah, I mean, at least here in Finland, there's no risk of you being unemployed if you're a nurse. There's always jobs available, and then even if you don't like your current workplace, you can change.
Yes, and it's very competitive. Like, I mean, the companies are they are competing to get nurses, and they offer quite well, like just to, or not quite well because it's not that enough. But just to
there is still
invite
competition nowadays with the salary also. Like you could go for the salary, you could go for something more interesting. Place or like that, and you could even decide not to work in one workplace. You could do like this. What was it called?
Like gigs.
Like you just choose what days do you want to work and what days do you not. Do you want to have a week off? Okay, you can. And then
you can
next
decide.
week you work a lot.
You don't have a fixed place where you work. So I don't know if this is common somewhere else, but here in Finland, there are a lot of manpower companies that offer this kind of possibilities for nurses and for practical nurses. Like, you just have their app, and then you choose, are you going to work today? Then you choose to work today, or what shift you want to work. Would you like to work 2 times in a day, and what's that, double shift, and
or
like
just
that.
a few hours, because sometimes you could even just work 4 hours.
4 hours,
Something like that.
Yeah, I don't know if that's available in Philippines also, but that's quite comfortable for me because I do other jobs. So if I have free day, then I can just choose to work. So there's always job if you are a nurse or if you're a layohoitaya. One thing that I don't like is that the aggressive patients and aggressive relatives.
Even, yes. Not, they don't necessarily have to be aggressive either. They could just be really mean. Because of course you understand that people that are sick, they will not always be themselves. So they might not mean it always. Of course there are also mean people. But like a lot of them I think are like they're sick, so they're just not themselves. They will say really mean
They are short-tempered. Have you had any encounter?
Of course.
Can you just share a little bit?
I don't know if I can remember any specific, but of course there are like always like, especially like people saying things, but even physical violence is.
Have you encountered physical violence?
No, not like that. Someone would have really hurt me on purpose. No, but there was like recently a campaign here. That talked about it. So 69% of nurses here have either encountered physical violence or threat of it.
69%. Can you imagine? That's more than half of the nurses encounter this kind of violence.
70%.
I can remember that I had few encounters and with violence. What I can really remember that really stuck to my mind was that a client told me like, "Go home where you belong."
I think maybe for you it's more likely to come like those type of things, like racist things.
But there are also like people or like patients who grabbed me so hard that I was really like can you help? Like I have to call my colleagues to help. Yeah, but the good thing here in Finland, they have this like a
Yeah, we have
like
like
a alarm.
not in all places, but in hospitals at least we have this like alarm that you can press if you're in a like violent, like your client or patient is violent, or you it's a threatening situation. Then you can press this alarm and it will alert guards and also your
colleagues.
workmates.
Yeah,
Yes,
they will immediately come to you.
Yeah.
How about you? What things you like and what things you dislike?
Well, one good thing is with nursing because you do shift work, which basically it could be a bad thing because it could be really heavy. But the good thing about doing shift work is you can have free days in the middle of the week when no one else is free.
Imagine free Monday.
Free Monday, for example, then you can do a lot of things because people are not in your way. Like you can get errands done and like that, which is really hard if you work Monday to Friday.
Yeah, you can visit bank and
Like all those kind of things. Or then you can just go places that are not as crowded because it's everyone is at work.
Yeah, when you have free Monday, that's really like the best. You don't have to wake up
You
early.
have to wake up. Everyone else is getting up on Monday and you're still sleeping. Yeah.
Yeah, I could relate to that. But how about things that you don't like?
Well, nursing is a stressful job. Like, yeah, but you could have 1,000 things happening at once. Like, and you just have to kind of prioritize what are you doing now and what are you doing next. Like, what is the most urgent? And then, like, you could have you're helping a patient and your phone is ringing at the same time. Are you going to answer it? Are you not? Like,
And someone fell again.
someone fell or the doctor wants to ask you something or
Relatives call.
yeah like that. Or and sometimes this could go on the whole day, like your whole shift is just like one thing after another and you don't get to rest. You barely have time to eat. You have to just like get into the break room to just kind of throw the food in your mouth and then continue.
That's that's actually also quite common that you barely have time to eat. Yeah.
Yeah, it probably depends on your workplace. There are like, but especially hospitals are like
Especially
this.
hospitals. Yeah.
And then there could be calmer places and calmer days, of course. And the good thing with this space is like your days go really fast. Like
you don't
I don't also like those days that sometimes come where there's almost nothing happening. And you just sit around and wait, or like you go and check on your patients too often and they find you already annoying because they're like, I'm fine, I don't need you.
Well, for me, I rather have that very fast pace, even though it's very
Something
stressful.
in between is like the best because sometimes the stress is so much that you just, at least me, I want to go cry in the bathroom.
Sometimes I just have to think that I hope this time will not end because I still have a lot of things to do, like like those. And for me, another thing that I like is that it's so rewarding to see people recover from their sickness. That's really what I really treasure most when seeing a patient coming in very sick and then you are part of the recovery. That
That's nice.
I have experienced those that really like very bad shape and very bad wounds, and yet they recovered. That's really something I really treasure.
Yeah, and sometimes you realize that the person that they were when they came in, that's not really them because they were so sick when they came that that they were just not themselves at all. And then some time goes by and you realize, this is the actual person, and this person is like so much happier, so much like just different and looks different also. Like
that's very
even
rewarding.
the face will change, even though they would have nothing done on their face, but the face will change. We just see someone else.
Common thing also in Finland, like especially for elderly people being rushed to the hospitals because I have worked in a hospital in a emergency ward, not in the emergency like really where the patient comes in, but in the emergency ward. People could come there very dirty, very like because they were abandoned, like elderly people, like almost abandoned. No one looks after them, and then they come in a very messy clothes and shit everywhere like that, and then after you have taken care of them, it's really nice to see that, like they are well dressed and like, I mean, like clean, and like their what's parta beard is shaved, and they're, yeah, like to see the person there like
Yeah, yeah.
recovered. It's really nice feeling. And what I dislike is that, or another thing that I dislike is that telling people the bad news. I have been so much in that. I mean, in many times in that situation that I have to tell the people or the relatives about the bad news, like especially like death or something,
Yeah,
of the of
if a patient or client dies, yeah, you will, as a nurse, you are most likely the one to call
Yeah.
the relative. Sometimes it's the doctor, of course, if it's very unexpected or
Yeah.
something, but most of the time it's you.
Yeah, I could recall one specific moment that when I called during the night shift, I called the son of a client, and then the son blamed me for the death. So
Yeah.
because he was in contact with me before that, like, can you tell the doctor this, and that the doctor should prescribe this medicine or something like that. And then the doctor said that no, we cannot anymore do anything because the patient has DNR, and that we cannot do that.
Yeah, like
So until the patient died, and then when I called, okay, now I'm sorry to tell you that your mom died.
Yeah, because of course it's hard to face
Yeah.
your relative's death, so
Yes.
you want to do everything.
Imagine to be a shock absorber. So the son answered like, "You killed my mom," crying on the phone. So that's I
You
don't
need
like
to
that.
know how to take it, that you don't take it personally, that you know that you didn't actually kill his mom. So but it can be really emotional.
Yeah, heavy. Yeah, you have to talk. I had to talk to my boss after that.
Yeah, for sure, for sure.
And you,
Something good.
something good again.
Something good. Well, nursing, there's a lot of variation in nursing. Like you can
Yeah.
work in so many different things. Like you could, I mean, you can work with the elderly, for example, just helping them day to day, or you could be in the hospital, in the ER, in the OR, in the home care, meaning you go to people's houses. Once you have a bit more experience, you could be in management, you
Yeah.
could be an entrepreneur,
Yeah.
you could do so many different
Entrepreneur.
things. Yeah.
So
Yeah, like both of us, like you have been working in quite many different
yeah, I have worked with elderly. I have worked with what's this? In hospital, in emergency, in batsakeskus. What's batsakeskus like? Like anything about here.
Yeah,
Anything
in
about
the
here.
stomach area.
Yeah. So yeah, and I've been working a lot in home care. Yeah, and also if you're a practical nurse, you can also work in the kindergarten,
Yeah.
something like that,
Kids.
with kids.
Yeah.
So there are a lot of areas where you can work. Hey, I have actually worked like few months ago. I've worked in a plastic surgery like hospital, like plastic surgery ward. Yeah, and I've seen I've seen myself like a patient who had sex transplant. How do you say it? Is it sex transplant?
It's not the sex.
What is that? So, what's that? What's that? Or what's that? What's that ba? Kanang sex change. Sex
They're
change.
transitioning, yes. So
Sex
they have
change. Tama,
they call
again.
it bottom surgery.
Huh?
Bottom surgery if it's down there. Top surgery if it's up.
Bottom surgery. Okay, again. Yeah, I actually now remember that I recently worked in what's this plastic surgery ward. I have seen a client who have undergone a what's that bottom
Bottom surgery.
Bottom
for
surgery.
their
sex change.
Yeah, for
Yeah, a man became a woman, and yeah, it was my first time to see, and we cleaned it. I cleaned it, and it looks it looks
Yeah, I mean,
it
plastic
looks
surgeons are really
exactly
good
how
nowadays.
it looks like.
Yeah.
Yeah, so it was my first time to see, and
Yeah, you can experience a lot of things as a nurse in different fields. So I have also been in like very, very wide range of different. I've been, well, with elderly a lot, but I've also been in the oncology, so working with cancer patients.
it must be hard there.
It
or is
was really hard, yes, yeah. Yeah. Because many of them don't recover. That's just the fact, especially if you're in the ward, you don't see those recovering that much.
Oh, yeah. Because if you are well, you
Yeah,
can.
you are an outpatient,
Outpatient,
most of
yeah.
the time. Yeah. Then I've been in different surgical units, vascular surgery, and also like stomach, different stomach procedures. What else? But now we're running our own business,
Yes,
so that's also
entrepreneur. We are now entrepreneur.
also a possibility. There's just so much. Like if you haven't found something you like,
Yeah.
you can explore and try different things.
Yeah. As Linda said, we now own our own home care here in Helsinki. We also work in Vanta and Espoo. Yeah. So just something different after 10 years of working. We just want to make our own way of doing things.
Yeah.
That's why we build this business. But yeah, and
Something bad then, or like the bad side, or like that I don't like. The salary is not great, especially if you compare it to other fields with the same
yeah,
level
the
of
same
education.
level of
Like,
education.
well, engineering, for example, it's
They earn
they
more.
have the same level of education most of the time. They have studied as long as us, but they earn quite a lot more
Yeah.
as a basic salary.
Yeah.
So that's
Even though we mentioned earlier that there are a lot of companies are competing in terms of salary, but still compared
it's
to
still
other
not to that
yeah,
level
to
of
that level.
other professions. Yeah.
Yeah. A lot
There's
of
been a lot of discussions and things about that, like
a lot of nurses also
strike last year and like that.
yeah shifted to other field because yeah it's demanding, physically demanding, and the salary doesn't relate.
Salary, and then also working conditions sometimes are not great. So
So my turn to
Yes.
say something that I like about nursing is that it's physical work. I like it.
like you get to move.
Yeah, you get to move like well now we work as a entrepreneur and we do a lot of visits to our clients, and I also do sometimes gigs in the city of Helsinki. I do this home care also. So yeah, I get to walk a lot. I get to drive car. I get to drive bike. I mean, like use bike in like in the city or any part of Helsinki. Yeah, and to be outside in like fresh air and and you sweat a little. I like it.
Yeah, and even if you don't have that job, even if you're in the hospital, you will move a lot. Like
Yeah.
you don't really need to think about that. That you will get your exercise like your daily. Of course, different if you want to go to the gym or whatever. But like what is this like?
Steps.
Everyday your steps will
Yeah.
definitely be full if you work because
Yeah.
you keep going. And in elderly homes, you might be going up and down the stairs. I remember because at some point we had these like watches, or like people usually keep them in their leg if they work as nurses because you shouldn't have any. And you could easily reach 20,000 steps in a workday.
Yeah, that's quite plus.
Yeah,
Like,
you don't.
health wise. Yeah, and what I don't like, and another thing that I don't like is that it's I could consider it as like doing a dirty job because you have to deal with different bodily fluids. I could say
blood and-
blood and shit.
Of course, that again depends. That again depends on what you
Where
work with,
and where do you work,
What
yeah.
is your what's this like tasks?
Yeah.
because you could have more computer tasks, for example.
Yeah,
It's not so, or that you mostly handle medicines. Then it's not so dirty.
Yeah, but you have to somehow also in other shift you can
yeah.
if you,
Wounds, whatever. Like
Yeah.
yeah.
if you don't have a strong stomach for that, then it might be challenging for you because like just recently I had one partner who not collapsed but what's that, like almost collapsing.
Almost fainted.
Yeah, who almost fainted because we have to dig into my to our client's wound,
Yeah.
and we have to cut the wound.
We don't too graphic. Maybe
Yeah,
someone else will faint.
Yeah, yeah. So
No, but yeah, like those things, and you have to be able to kind of manage it. And sometimes there will be surprising things, like like someone suddenly will vomit and like that.
but actually, it's something that I like, and something, and also at the same time I don't like.
You like vomit?
No, I don't like vomit. I don't like vomit, but those wound and
I like
those.
those type of
Yeah.
things. Yeah.
But not like diarrhea or something, vomiting. Not like that.
But yeah, you just if you're thinking about are you going to be a nurse or not, you just consider also that can you stomach all those things.
Yes.
But some of it do come also with the experience. Like in the beginning, it might be hard, some things, and you might start feeling sick when helping someone with wounds and like that. But after a while, you will get used to
Just
it.
get used to it. Yes.
Because there is this like, that we also forget when we eat with other people. But if you eat with nurses,
during our
anything it could
during
be
the break.
topic, and very yucky things, and no one will mind. They will just keep eating. Like,
Yeah, it's very common in the taukuhu anywhere, like the break room, and then just you are eating with your soup, and then someone will just come in. Hey, what color is the sheet of the,
Yeah, like-
of this patient? Because I need to know if he has a melena or what, like
very normal.
And then you just eat like, it's normal, okay. Or there's blood there. Yeah, it's very normal. So sometimes we do forget. Yeah, we do forget with others non-nursing.
Especially because we're both nurses, so
Yeah.
we talk, and then sometimes we forget that this person is not a nurse. Like maybe we should not talk about this because maybe they will lose their appetite.
Yeah. So now your turn.
Okay, something I like. Well, you can always learn new things. I mean, that goes with the variation of the job. Like if you have been in a place for a long time and nothing is really changing there and you don't learn, you can choose to go somewhere else, and there you will learn new things because there's so many specialties that it's impossible for you to already know everything.
Yeah.
And also nursing is like, it's all the time like developing. Like there will be new things. Yeah, there will be new things in your current workplace as well. Like nowadays we have this like kind of like a phone in the hospital that you bring with you, and you can do a lot of things with that. You can already record all the vital signs. You can
Take picture of the
take
wound.
pictures, and then that one will also like help you with like making sure that medicines you give are correct, because you just read.
And making sure that the blood goes to the right patient.
Yeah,
The
like
right blood, right patient.
Yeah,
something
those
like
kind of things like that you before have to check manually. Now it's now you have this like helper, which not everyone likes that you have to learn new things, but if you're that kind of person that kind of need to develop all the time, it's really nice.
It's really good, yeah, and it's good for you as your professional growth. Like you are updated about the current trends. Like for example, in Finland, they are now really focusing on the like digital things and how you do things digitally.
Yeah, and how you use it to help. Yeah, for example, like that, like helping the medical, like the what is this medicine? No, what's it called? Making sure that the right patient gets the right medicine and like that for those things, or like in home care, they have now a lot of these like virtual visits to kind of check up with clients in the Middle East.
So there's a lot coming.
Yeah, like those things.
Every now and then there are new things, and you have to keep yourself updated.
Yeah, but also apart from like those type of development things, you could just, if you want to change a little specialty, for example, in the hospital, you can, and you can learn new things about something else. Like maybe you want to learn more about heart diseases. You go work in the ward.
You just have to be brave.
Heart diseases.
Yeah, I think you just have to be brave, and I really encourage everyone. Like if you're a nurse, you just have to explore different fields until you find the best field. The best area, and explore different areas so that you can find where you really like. Because there are a lot, and you just have to you just have to put your one foot forward and apply there, and because there are jobs.
There are jobs.
Yeah, there are jobs. Something that you don't like.
Well, people die, which is sometimes like I have learned to like even like appreciate it, especially if you work with old people, like really old people, and they have kind of lived their life already. They're happy to die. They want to die because and then they're not necessarily suffering or anything. They're just old and they're kind of like ready. So it doesn't need to be a heavy thing. For when they die, it's not anymore heavy for me. Of course, the first times I encountered that, it was heavy still. But then, especially I work in the cancer ward. That was heavy because there, even young people die.
Yeah, your age, right?
Or like now they would be younger than me. I was really young when I worked there. That was my first job out of nursing school, which was maybe.
Yeah, I cannot.
Maybe a bit heavy to start with that, but I mean, there was a lot of things I liked about working there, but the people just declining and dying, that was really, really heavy.
Yeah, and also like I don't in relation to that, I don't like seeing kids like
Sick kids.
sick and really like dying kids. I cannot do it. I cannot handle it.
I haven't really worked with kids.
But we
like only in the Philippines.
In the Philippines, that is so tough.
It's really hard.
I really cried. Like I cannot handle it when a kid dies.
Yeah, like young people, really, it's hard.
I cannot.
It's hard. But old people that are ready, it's kind of like also just seeing the
life cycle,
because it will all end, and if they can end their life in a way like that, like without suffering, and they're just happy with what they have already gotten, and that's nice.
Well, I guess that's all for now.
All that we have. Yeah, but if you have other things you like, dislike, you can write them.
You can write in the comment. And how many years have you been in nursing? And you can
let us know.
Yeah. Put in the comment below. Okay, so
that's it for
today.
Thank you for watching.
Thank you for watching. Bye.
Bye.